Hi, welcome. My name is Dr. Amy Abelar. Thank you for watching. You are probably watching this video because you either have a polycystic ovary syndrome or a PCOS diagnosis, and you are looking for more holistic options for managing your symptoms, or you don't have a PCOS diagnosis, but you are suspecting that you might have PCOS. Either way, this video will be very helpful information to you. After you've watched this video, there will be a lot of other options of educational content that's available to you on our website, both free and paid. Things like general videos on trying to conceive with PCOS, nutrition for PCOS, supplements and herbs for PCOS, and a bunch more. Before we dive into the content, a brief intro about me and why you would want to listen. I have a master's in traditional Chinese medicine and a doctorate in acupuncture and integrative medicine. My doctoral thesis was on, as you guessed it, PCOS. I am super passionate about helping women with PCOS because, as the name states, polycystic ovary syndrome is a syndrome. It's not something that can be cured, but it is something that can be much better managed outside of Western medicine. So women seeking help with their symptoms of PCOS are often denied testing, they're denied a diagnosis, they're told that what they're experiencing is normal, even though that is not the case. And even though there's not very many options available to you from a Western medicine perspective, since there isn't a cure, it doesn't mean that there aren't options. It just means that the options that are available to you are typically outside of what most Western medicine providers can offer. And that's where I come in. I have researched so many medical journals, PubMed articles, books that specialize in PCOS, and found studied holistic treatment options that give you real results and give real results to my patients in clinic. As a side note, at the bottom of all my sides, you will see the link to my reference page, and that lists where I get all of my information in case you want to go check out these references for yourself. Okay, so as my background is in treating infertility and regulating the menstrual cycle, all you probably can guess that my passion for women's gynecological health is also because women are constantly being told that that their menstrual cycles that the symptoms that they experience are normal, or that their infertility is unexplained, when unfortunately that's not the case. And there's so many holistic options that are available to you. I cannot even count the number of patients that I've treated who have seen so much improvement in their next menstrual cycle with sometimes as little as one acupuncture treatment. So now that you know that I'm passionate about women's health and the menstrual cycle in particular, let's dive into PCOS. All right, some PCOS statistics. So, polycystic ovary syndrome affects an estimated 8 to 13% of reproductive age women, and up to 70% of those affected women are still undiagnosed worldwide. PCOS is the most common cause of anovulation, and it's a leading cause of infertility. And PCOS is also associated with a variety of long-term health problems that affect both physical and emotional well-being. We'll get into those a little bit later. And PCOS is the single most common endocrine disorder in women of reproductive age. Some common symptoms. Get to my next slide here. Some common symptoms of PCOS can be irregular or long menstrual cycles, acne, unwanted body hair, male pattern hair growth or loss, alopecia, hirsutism, delayed ovulation, no ovulation, occasional ovulation, erratic and ovulatory bleeding, weight gain or obesity, sometimes difficulty losing weight, heavy bleeding, pelvic pain, dysmenorrhea, which is painful periods, chronic inflammation, fatigue or low energy, poor sleep or sleep disturbances, mood changes, anxiety and depression, poor body image, multiple patches of cervical mucus, which happens when your body is trying to ovulate, but it doesn't. So after seeing this list, you're probably thinking that either, wow, I'm experiencing a lot of these symptoms and I think I could have PCOS, or maybe you already have a diagnosis and you didn't realize how many symptoms you experience that are possibly related to the PCOS diagnosis you have. So if you don't already have a PCOS diagnosis, we are going to go over the diagnostic criteria. So how do you get diagnosed with PCOS? The most common criteria is the Rotterdam criteria. This requires that 2 out of the 3 of the following findings are present for you. And those are hyperandrogenism, ovulatory dysfunction, which can create irregular cycles, and polycystic ovaries. And then, of course, we also need to rule out any other causes of hyperandrogenism or ovulatory dysfunction. Unfortunately, receiving a diagnosis, an official diagnosis of PCOS, can often be a very difficult road for patients. There was an international study done of almost 1,400 women with PCOS, and that revealed that receiving a firm PCOS diagnosis often took over 2 years, and it required an average of multiple visits with an average of 3 or more healthcare professionals. Another study identified that almost 1/3 of reproductive endocrinologists and 2/3 of OBGYNs were not able to clearly identify the Rotterdam criteria for diagnosing PCOS. And that same study found that few of those providers were even aware of the associated health conditions to screen for, like diabetes, high cholesterol, high blood pressure, obesity, and more. And as I mentioned, we'll get deeper into those later in this video. So, as I mentioned, you need at least 2 out of 3 of these criteria in order to receive a PCOS diagnosis. And because there's those different variations, we have 4 different phenotypes or subtypes of PCOS. So, this spreadsheet here, you can see there's type A, B, C, and D. Type A has all 3 present: the polycystic ovaries, the hyperandrogenism, and the irregular cycles. Type B just has hyperandrogenism and irregular cycles. Type C is polycystic ovaries are present and hyperandrogenism. And then type D is polycystic ovaries and irregular cycles. So some providers might just do an ultrasound of the ovaries, and if there's no cysts, they may rule out a PCOS diagnosis and just move on. But as you can see, the phenotype B here has hyperandrogenism and irregular cycles, but no cysts on the ovaries. So this person still has PCOS, even though they don't have polycystic ovaries, technically. So each of these phenotypes are equally problematic for women's health, and they need to be properly managed. Unfortunately, the current Western medication options are managing PCOS is going to be birth control, IVF, metformin, medications for symptoms like acne and hair loss, and then a general recommendation of weight loss, which for most PCOS patients is honestly so frustrating because they likely have been either trying to lose weight for a really long time without a lot of success, because unfortunately their hormone profile and their insulin resistance makes it much more challenging for them to lose weight. So most women with PCOS need a more guided plan for nutrition in order for them to have success with weight loss. Again, this is especially if they have insulin resistance. And so we're going to break down each of these Western options a little bit more. Birth control is the first one. That's a super common Western medication that's used for PCOS. However, there are a lot of women who either are not willing to take oral contraceptives or have other health conditions where oral contraceptives are not going to be indicated for them. And there's a lot of women who just don't want to take it, rightfully so. And you have options. So there's also a lot of women, though, who are trying to conceive that and so birth control is not going to be an option for them either. And there's also a long list of side effects related to oral contraceptives for everybody in general, but some of these can actually be especially bad for women with PCOS. So this includes that oral contraceptives do increase the risk of cardiovascular complications as well as aggravate obesity, which are 2 things that a lot of women with PCOS are unfortunately already up against. The second one is IVF. So Clomid is often introduced as a medication to induce ovulation in women with PCOS. And this can be either on its own or as part of an IVF cycle. And Clomid has its own list of side effects, which are hot flashes, breast discomfort, abdominal distension, nausea, vomiting, nervousness, headache, hair loss, disturbed vision. Fun, right? So women with PCOS, unfortunately, are also at higher risk of hyperstimulation during egg retrieval, which is not good. I've seen patients of mine with PCOS who are going through IVF and they did get hyperstimmed, and it was really, really tough on their bodies. So as a side note, hyperstimulation might not sound so bad because it makes us think that they got a lot more eggs out of one retrieval, more bang for your buck. But unfortunately, the number of eggs that you initially receive always shrinks down dramatically once once you've waited for them to mature, fertilize, past genetic testing. And women with PCOS are also more likely to have a lower egg quality. So getting more eggs in one pass is not necessarily a good thing. And as I mentioned, hyperstimulation can be really unhealthy and sometimes very dangerous for patients. The next one is metformin. Metformin has been used to treat insulin resistance, the insulin resistance piece of PCOS. However, it's also associated with a high frequency of gastrointestinal adverse events, and sometimes it increases the risk of lactic acidosis. One of the supplements that I use for my patients is myo-inositol, which has actually outperformed metformin without the side effects in multiple studies. And then treating acne or hair loss with other medications. So frequently, acne is treated with a regimen of ongoing antibiotics, which can really wreak a lot of havoc on women's gut health. So for many of the patients that I've treated for severe gut health issues, just as a separate thing, not even related to PCOS, but women that I've treated with severe gut health issues, they tend to have a history of long-term use of antibiotics for acne. Even years and years after stopping antibiotics, their gut health is still really struggling, and they're often very sensitive to many different foods, or they get sick really frequently, or both. So in general, let's just say medications to band-aid symptoms is not going to be your best approach. And as I mentioned earlier, that there's a lot of Western providers in that study that didn't really know what other health conditions to screen for. So we're going to go over what some of those are. Some of those other health conditions that are related to PCOS are high blood pressure, cardiovascular disease, infertility, obesity. With PCOS, you're actually 2 times as likely to develop metabolic syndrome and 4 times as likely to develop type 2 diabetes. There's also an increased risk of ovarian and endometrial cancers, chronic inflammation, insulin resistance, dyslipidemia, high cholesterol, sleep apnea, depression, non-alcoholic fatty liver disease, preeclampsia, gestational diabetes, miscarriage, and preterm labor. So this list is long and it's overwhelming. And my intention is definitely not to scare anyone, but to give you complete information so that you can make the best choices for your health. And because of how long this list is, I feel like it's so important that women receive an accurate diagnosis of PCOS if they have it, and that the rest of these potential health concerns are also being checked for and monitored and screened. Okay, so the good news is that we treat PCOS with great success using more holistic options and like stabilizing your blood sugar, helping you lose weight with nutrition, supplements, and tips that have actually been studied to lead you to success. We also regulate your menstrual cycle, get your ovulation back to optimal timing, which is super important in general for women's health, but also very important if you're trying to conceive. We can reduce your PMS symptoms. We can help you reduce inflammation, reduce stress, optimize your sleep, support your gut health, reduce your exposure to environmental toxins that are throwing off your hormones, and then support your body's natural detox pathways. So, before you start to feel too overwhelmed, go ahead and take a deep breath. I know that there's a lot of unknowns, but please trust, this is our specialty. When we begin treating women with PCOS, we run a large initial panel that's a blood panel that checks for many of the related health conditions, as well as the signs of hyperandrogenism, and then checking, of course, for irregular menstrual cycles. So if your labs are showing that there are any of these kinds of issues in any of those categories, we will treat and monitor those as well as the PCOS so that you know that you're covered. All you need to do is get the blood work done and then follow the plan that we create. It can really feel like information overload sometimes, but if you take it one step at a time, you will be so happy later that you got your health on track. And if the labs show more than what's within our scope to handle, we will refer you out to the right specialist to take over that portion of your care. Okay, so let's get into some options for testing and treatment. If you already have a PCOS, even if you already have a PCOS diagnosis, it's likely that you haven't been checked for a lot of the other health conditions that I previously listed that are associated with PCOS. So I highly recommend doing the full lab panel to make sure that we don't miss anything. So let's go over some of what is within my scope, outside of my scope, what your options are for treatment. So what is not within my scope as an acupuncture and integrative medicine doctor is I cannot order an ultrasound to check for your cysts. I cannot test you for sleep apnea. I cannot screen you for cancer or cancer risk, and I cannot bill your insurance at this time. Those would all be things that your primary care or your OBGYN would be able to do for you. And then what is within both my scope as well as Western providers? So we can both order your labs to check for your hyperandrogenic markers. We can check for other markers of PCOS, as well as labs to screen for the other health conditions that I mentioned that women with PCOS are at risk for. One of the challenges that I mentioned earlier, a lot of Western providers are not aware of the diagnostic criteria or the other health conditions to screen for. So this can make it really difficult sometimes to get your doctor to order all of those labs for you, because if they don't understand the justification in ordering those labs, then they won't order them. If this becomes a headache for you, or if it becomes a fight with your doctor to try to get these labs run, just do our panel and we will do it for you. And then what I can do that your provider won't do. So next up is this slide here. I will offer, what I can offer you is a customized holistic treatment plan. So we order supplements for you. We make a nutrition plan for you. We follow up with you regularly about your progress. We order labs for you, like a 24-hour diurnal saliva cortisol test, heavy metal testing, food sensitivity testing, lots of other testing that we can do. I also look at your labs through a lens of optimal ranges where you would be symptom-free, as opposed to Western ranges that are often way too wide, where patients end up feeling like they're still symptomatic even within quote unquote normal ranges. So what is the next step? Next step is going to be to get your labs done. So this is either going to help establish a PCOS diagnosis if you don't already have one, as well as give you a baseline of labs that we can use to track your progress as you begin treatment. And if you do already have a diagnosis, again, this is going to give you that baseline of labs so that you can track your progress during treatment and see that everything else that we're working on monitoring and working on improving is easily measured, not just by the symptoms that you're experiencing diminishing, but that you can see those labs improve as well. So that's always really fun to watch those improvements for patients. And then you can, of course, just go to our website, order the full blood panel out of pocket, and just get started with us right away. Currently, our full blood panel is priced at $300, which is based off of the direct lab prices, those are not in our control. That's just the cost of running that full lab panel. And then the online lab that we use does offer a 3-month interest-free payment plan. And even if you are not local to us, we can work with you via telehealth. So the online lab that we use has phlebotomists all over the US to assist with your blood draws. Then we get the results and manage your treatment. So I'm always going to encourage patients to try to use their healthcare first if they can, get as many labs covered and run through your insurance as possible. Whatever your doctor doesn't run that's within our scope to run, we will absolutely run for you. So you can always look at that option. If you are choosing that route where you want to try to have your doctor run some of these labs for you, and then we just run the pieces that are missing, you can do that. And then a lot of you who already have a PCOS diagnosis, you're wondering, I'm sure, what else can you do to just get started right away while you're waiting for your labs to get run and get your results from that for the concomitant diagnoses. If you already have a PCOS diagnosis, some of the things that you can do are acupuncture. So if you are local, come and see one of our acupuncture doctors at Nurturing Touch. And if you are not local, you can look up the acupuncture providers that are available near you on either your state's acupuncture licensing board's website, or you can look up providers at nccaom.org to look up some nationally certified providers. So acupuncture is really amazing at a lot of different things, but this list here are things that are specific to PCOS. So we can help with the menstrual cycle regulation, decreasing stress, balancing hormones, treating anxiety and depression, helping with high blood pressure, helping support your metabolism, decreasing inflammation, treating infertility, and decreasing the risk of miscarriage. So, again, those are things that acupuncture can do that are specifically helping with symptoms of PCOS. And then the next thing that you can do is to work on decreasing your environmental toxin exposure. So, the Environmental Working Group actually did a study that found that women are exposed to an average of 186 chemicals per day. Some of these worst offenders are going to be cosmetics, body care products like shampoo, conditioner, sunscreen, lotions, perfumes. We're also exposed through cleaning products, laundry detergent, feminine hygiene products, hair color, nail polish, deodorant, just a lot of different things. Microplastics are even entering our bodies because of dishwasher pods, leaving microplastics on our dishes that we end up ingesting them. There's a study that showed that these microplastics were ending up in breast milk, and it was through dishwasher pods. So these toxins are creating major health issues for women, and they are majorly affecting our hormones. So, if you're interested in working on decreasing your exposure to these environmental toxins, you can also visit our website. We have a list of non toxic or low tox products that you can switch to start decreasing that toxin exposure for yourself. And then we also have more videos on this on our website. Another thing that you can do is to, of course, like I mentioned, start ordering the labs with us that your doctor is not, the ones that your doctor's not going to run. So saliva cortisol tests are not things that Western medicine providers typically run. Cortisol is your stress hormone. And when cortisol is out of balance, it's going to affect your sex hormones, which affects your PCOS. So doing a 24-hour saliva cortisol test is going to give us a picture of how your body handles stress throughout a full day. So we can see if you might need some support for your cortisol as well. And then when your body is in a state of constant fight or flight, you're going to have unwanted symptoms like extreme fatigue during the day, especially after exertion, difficulty falling asleep at night, waking up in the middle of the night with trouble falling back to sleep, difficulty waking up in the morning, even if you've had a full night of sleep, bloating, weight gain, low libido, anxiety, food cravings, typically for salty foods, frequent illnesses, weakened immune system, and a whole bunch more. So, if you are ready to get started, then I would go to our website, nurturingtouchacupuncture.com, and click the Order My Labs button on our homepage. On our website, you can also see other videos that we have about nutrition for PCOS, herbs and supplements for PCOS, trying to conceive with PCOS, a whole bunch of content. We also have digital downloads available for things like low glycemic index foods, which is really key for the insulin resistance piece of PCOS. We have lists of foods to eat, foods to avoid for PCOS. We have a whole bunch of content for you. So honestly, becoming your own expert on holistic options for managing PCOS can dramatically change your quality of life. And we really encourage you to take that step. So thank you so much for watching this video. And if you like the content and felt like it was helpful, please like and subscribe. We'll see you in the next videos.